more like 50, but yeah.
Under 50, okay. Still not eligible on Monday. A lot of other states are fast-tracking the vaccine timeline for getting more doses. Will you?
I think our timeline is consistent with the recommendations that were made by our advisory group. And I can't continue to stress that our focus from the beginning of this has been on those most vulnerable. And I think in many respects, that's where it should be. By having everyone eligible by Patriots Day, April 19th, we will have given the most vulnerable among us in Massachusetts the opportunity that they need to get vaccinated. And we've had tremendous success so far with this rollout in getting big chunks of the population associated with each of these categories vaccinated before we moved on to the next one. You know, people tell me all the time that there are other states that have broader eligibility standards than we do. Every single one of those states that people have raised with me that was a significantly sized state has vaccinated fewer people as a percent of their population fully, fewer people in terms of their first dose, and typically in most cases have not put as much of the vaccine that's been made available to them to work as we have. Eligibility is one thing. Actually executing on the ground and getting big portions of the populations that are eligible vaccinated is another. And I think the way we've set this up has been the appropriate way with a lot of great guidance from a lot of people on that advisory board from the beginning.
Sounds like the 100,000 doses of Johnson & Johnson vaccine we talked about yesterday, it sounds like that's not part of this federal mix-up right now. Yeah, good news,
Right.
Good news.
Yeah.
Big deal. So can you tell us where these doses will go? Where do you envision them going?
Do you want to speak to this? I think the answer is going to be everywhere, but there are several.
You can say that at the microphone.
Look,
Both of you.
I mean, remember, there's two channels this is going to travel through. About half of them are going to go through the retail pharmacy channel, which means they will sort of be in addition to what many of the CVS and Walgreens folks have been doing on a single-shot basis so far. In some cases, CVS and Walgreens have opened up sites that aren't normally open to do the one-shot thing just to get it done. Given the size of this, I don't know if that's going to be the strategy they use or not. Have they told us how they plan to do it yet?
The retail pharmacy?
Yeah.
The CVS and Walgreens are going to do basically sort of open up about 20, 30 stores.
Yeah, right. I mean,
And then they'll close them.
so they'll, yeah.
So the great news is the governor says the 100,000 for next week is not in jeopardy. Thank you. And we're going to use it in a number. We're going to basically take most of our non-mass vac sites and sort of distribute across regional collaboratives, community health centers, our homebound program, low-income senior housing, and literally take the 100,000 and just across most of our supply chains, with the exception of the mass vac sites.
Can you tell us why? Why are you choosing to go that route?
So this is a one-time bolus. So it's unclear. So as the governor said, we know we're going to get this 100,000, but then the J&J for us going forward the next few weeks is sort of under review right now. So we don't know if that's part of what's been the manufacturing issue. So if you have just a one-time bolus, instead of starting a new program, the best way to utilize this is, as the governor said, I mean, we're very good now at distribution to allocation to administration, is to take our existing channels and pump it out. So we can get 100,000 potential doses out next week, and that's 100,000. So J&J is one and done. So that'd be 100,000 people newly vaccinated, fully vaccinated in the Commonwealth.
Is there a danger of what happened yesterday, the news out of Baltimore, 15 million doses nationwide in trouble or not good? Next week's all set here. You're sure of those. But how about the weeks after that? Is there a concern that you're going to have a drop-off?
So for us with J&J, we have not had, for the state's distribution, a steady supply of J&J. We had like 7,000 one week, 9,000 another week, and then, had this wonderful news of 100,000 for next week. The federal government has indicated that the next few weeks' doses is under review, and we will have more information about that next week. But this, again, 100,000 first fully vaccinated individuals is a great opportunity and challenge to have to push it out next week.
Governor, I have a question in terms of, obviously these equity efforts, a lot of folks would argue are long overdue, right? But there's increasing data that shows that white Republican males are the ones that are the largest population that are hesitant to get the vaccine. So as we focus on this equity piece, is there a plan for outreach to that community?
Keep in mind that most of the folks in almost all the survey data that's been done who are hesitant are not never. They're just not now. And I think for many of those audiences, some of the commentary that was offered by both Gladys and Manny speaks to the fact that a lot of folks in communities of color have a lot of very good reasons to be hesitant about this and to take a wait-and-see attitude to it. And I think organizations like East Boston Neighborhood Health Center and La Colaborativa are the kinds of organizations that are going to help move this. And when we were down in Brockton talking to the folks at Brockton Community Health Center, which has actually done a terrific job with this stuff so far, they made clear that they are getting folks who were hesitant to start coming in. And I do think the door knocking that Gladys's folks are going to be doing, the resources we're going to make available to those 20 communities that they can figure out how to move the needle forward will make a difference. I think the door knocking and the campaigning that Archipelago and Healthcare for All are going to be doing, both organizations that know these communities really well, will help. I think when it comes to other parts of our Commonwealth, Republican white men, I think for them it's going to be the same game. It's going to be because their neighbor got it, or their coworkers got it, or their doctor reaches out to them and says, you really need to get vaccinated. It's going to be that sort of message that's going to move them. But the way we're thinking about this at this point is there are 1 million people who have pre-registered in Massachusetts to get vaccinated, okay? And we haven't had any trouble with our regional collaboratives filling every single slot they have. And even as CVS and Walgreens have significantly expanded their capacity, as the feds have put a lot of vaccine into that channel, every single appointment gets booked. So there is tremendous demand among those who want to get vaccinated here in the Commonwealth. We have tons of work to do in those 20 disproportionately affected communities that we should do to try to encourage and pull people in, and to get to people who may not be able to get to a vaccination site on their own, even one that's centrally located like this. One of the things Secretary Sutter said we're going to do with some of this J&J, because it's one and done, is go to community centers and senior centers and pump some of this to the mobility program, because you don't need to come back and schedule a second dose for a lot of those folks. But I think for a bunch of people, there's a hesitancy, and it's different reasons for different people. And part of this, the more people you get vaccinated, the more familiar people become with other people who've been vaccinated, the more likely you'll be to get folks here vaccinated, but also to get some of the white populations that are hesitant to get vaccinated as well.
Governor, given the fact that people are hesitant, and the fact that somebody messed up the recipe for Johnson & Johnson in Maryland, are you concerned that people will go show up, you get J&J, and they won't trust it?
You know, I would hope, I mean, the message I take from this is actually the opposite, which is people screwed up, people recognized, people ditched it, right? I mean, the message to me is whatever the control process was that was in place there, it worked. Those vaccines didn't get distributed. It's a shame to have 15 million vaccines when you're in a race against variants go down the drain. But the good news is the control process worked. They realized they had a problem, and they didn't ship any of them. The overall real-world experience we've had so far with all 3 vaccines in Massachusetts is borne out by the experience we've had since we started vaccinating people in December. I mean, we have less than 1,000 people over the age of 70 showing up on our daily dashboard as positive. Less than 1,000. I mean, that number used to be multiple thousands across every single quintile of the population in that group. And that number continues to go down for the over 60 population as well as they get vaccinated. I mean, the proof on the quality or the performance of the vaccine in Massachusetts, I think, is pretty evident at this point that it works.
Governor, any plans at this
I
point?
love your line, by the way, Gladys. Don't be afraid of the vaccine. Be afraid of COVID.
Any plans at this point? Yesterday Pfizer said that their vaccine is safe for 16 and under. Plans to vaccinate 16 and under school children?
I think we're going to wait and hear what kind of guidance we get from the federal government on this issue. Look, I think the fact that that kind of clinical trial is going on, not just here, but in other places, is a really good thing, because people are going to want to start to know once we get through the 18 and up population, 16 and up population, how are we going to deal with younger folks, and having clinical trials there is a good thing. But that's a perfect example of something where, you know, firms run the trials. They seem to promote the positive results more quickly and loudly than they promote the results that aren't so positive. And my view is we should wait and hear what the feds have to say about
Governor,
this.
what about type 1 diabetes? Will you consider adding them to the list before April 5th when the one medical condition people are eligible?
Is April 5th like Monday?
Yeah.
Before Monday? I mean, we can talk to the advisory board about that. But generally speaking, the biggest change we made relative, and they made relative to the CDC recommendations was around asthma, and that was specifically to deal with the environmental justice issues associated with asthma, especially in communities like this one.
But they added type 1 diabetes, so I'm just wondering, when are you going to align with that guidance or not?
We haven't aligned with all of their guidance from the beginning.
Governor, are there any plans to scrap mod at all?
We've talked to many of the regional collaboratives about whether they want to be part of the pre-registration program. And I think in the month of April, you will see some of them come in. But we've said to them that this is their call. So it's going to depend to some extent on whether they want to be part of the pre-registration system or continue to operate on that platform.
Governor Ambrosino and Manny Lopes, now that we're here, a lot of critics have criticized the state and the governor on the rollout in terms of communities of color. You guys work, you're from Chelsea, obviously the hardest hit, you're working in the community. What's your response to those folks who say that this administration has not been responsive to, during this? We want to hear from you guys.
Look, I can just speak from the Chelsea perspective and say that we have gotten tremendous support from Secretary Sutters in terms of getting vaccination to our residents here in Chelsea, including most recently this push to do mobile vaccines. In addition, the administration was particularly helpful to East Boston Neighborhood Health Center in terms of getting them to the kind of support they needed to open a clinic right here in downtown Chelsea. I mean, we've been vaccinating people in our downtown for almost a month now. So I would say that my experience in this city has been that the administration has worked extremely hard to ensure that we have adequate sites and adequate vaccine.
Thanks, Tom. And I would just add that this site could not be possible without the partnership and the support from the state and the governor and the secretary. When we were setting up our sites, this was the first phone call that I made, told them about our plans, and they said anything we can do to help, including sending the National Guard into East Boston and as well as Revere, which helped bring some of our staff over here to Chelsea. So I would say look at the data. Just recently looking at, as the governor mentioned, the population, the first group that was eligible, we knew were the healthcare workers. Second group was 75 plus. We vaccinated in Chelsea over 80% of the 75 plus and over 70% of the 65 plus. So again, look at the data, definitely hesitancy, but in terms of supply of vaccines, staffing, and space, my 3 S's that I've always talked about, the state has really helped us.
Governor, question about MCAS. It looks like that Commissioner Riley has recommended that MCAS will be waived for 11th graders. Any response on that?
The, almost all the issues associated with figuring out where kids are, given all the issues associated with school, both last spring and this year, is a challenging one. I think what I would say is the Lieutenant Governor and I have spent a lot of time talking to the Commissioner and his team about this, and some of it's about logistics, some of it's about time, some of it's about alternative strategies to figure out where kids are. I think the Commissioner's making what I would describe as a tiered approach to dealing generally with MCAS and with assessments overall. But I absolutely believe that with the federal resources that have been made available to local communities and to the Commonwealth, we have to have a really robust summer school program for kids. And if we don't have one, shame on us, because by that point in time, the vast majority of the population that wants to get vaccinated will be vaccinated, and probably a bunch of the folks who are now hesitant will also be vaccinated. And we really need to make sure that we do all we can for kids to ensure that by the time they get back to school in the fall, or by the time they go off to college, or whatever it might be, that we've given them a significant opportunity to catch up on all that's been lost.
After the 100,000 doses from J&J next week, are you expecting more after that, or that's still the open question?
That's the big open question at this point. We don't know at this point in time what the next round. I mean, the J&J stuff, generally speaking, has been lumpier than the Pfizer and the Moderna. I mean, Pfizer and Moderna at this point are pretty much running. You know, we're getting what we got every week plus a little more, pretty much. That's been that way now for over a month. But the J&J stuff has been lumpy. We were really excited about the fact that after, you know, a bunch of weeks of hearing that it was coming, there was finally this really significant move upward on J&J, which with the one dose creates a lot of opportunity. But we don't know we know it's next week, but we don't know what's happening after that.
Does what happened to the 15 million impact that, do you believe, make it even more uncertain?
I don't know, because they manufacture in 4 or 5 different locations, and I don't know, we don't know yet. I'm assuming we'll find out sometime next week what the impact of that was, or even what the denominator is in terms of how much vaccine they're actually producing at this point.
Thanks, guys.
Could you or Director Vega speak to whether any of the hesitancy comes from fears related to some of the public charge rules that have existed, and what efforts have been made to sort of address the chilling effect that could deter people from getting help?
Boy, I mean, the public charge thing's been repealed, right? So at a minimum, no, why don't you speak to that, Gladys?
Yeah,
By the way, can you answer that one in English and Spanish, please?
Okay. So in terms of the public charge rule, so immigration issues always plays a role, especially in communities of color and communities like Chelsea. But we have done everything possible to address those issues, to say that public charge has not been implemented at all. And please do not make that an excuse to not get vaccinated. We make sure, and we tell them all the time, listen, if we're behind the vaccination, it's because we're asking you to trust the government, this government of Massachusetts, make sure that you get vaccinated, because we haven't heard any cases that refer anyone for immigration because they're seeking vaccination or because they're sharing information. So para las personas que tienen una preocupación sobre el público, la contabilidad pública, por favor, no presten atención a eso. Una vez más, esto no tiene nada que ver con inmigración. Las vacunas son importantísimas para salvar vidas, pero aquí no hay inmigración. En el gobierno de Massachusetts no ha corrido un rol con nada que tiene que ver COVID-19 o con nada que tiene que ver con las vacunas. So, queremos que las personas se vacunen. Inmigración aquí no hay nada que ha indicado a nosotros que se está compartiendo cualquier tipo de información. Gracias.
Thanks, everyone.